New York City is heading toward a high-risk rating for COVID-19 transmission, even as hospitalizations and deaths remain relatively low, city officials announced Monday. A City Hall press release issued Monday morning, which includes information on mask and test distribution efforts, said they are coming as the community prepares to potentially enter a high alert level in the coming days. The announcement comes exactly 2 weeks after health officials raised the Big Apple's alert level from low to medium as cases surged and crossed the threshold of 200 cases per 100,000 people, according to the May 2 survey, when the 7-day average positivity rate in the 5 boroughs was 7.17%. 8 days later the figure rose to 8.03%, the latest city data available. This anticipated increased alertness came after the positivity rate rose from just over 1% in early March to over 6% by the end of April. But from May 2 to May 10, coronavirus-related hospitalizations fell to 54 from a weekly average of 71 people as deaths remained flat. As the 5 boroughs move out of moderate and into high from the COVID risk classification, the Department of Health and Human Services is advising New Yorkers to wear a face mask in all indoor public spaces and crowded outdoor areas, according to color-coded coronavirus alert level guidelines, rather than just closed settings where vaccination status is not known. High risk also means city dwellers are advised to limit gatherings to small numbers. The recommended actions for government column of the Department of Health's coronavirus criterion also includes imposing a mask requirement in indoor public spaces. But when New York City was placed on a medium alert in early May, Mayor Eric Adams chose not to restore the key to NYC indoor immunization requirement he lifted in March, despite the chart telling the city to think about it in response to the continued surge in cases. City officials will be distributing 16.5 million more at-home COVID-19 testing kits and 1 million high-quality masks to places like public schools, 1,000 community organizations, libraries, places of worship and politicians' offices over the next month, the said press office of the town hall on Monday, with both Gov. Kathy Hochul and Mayor Eric Adams recently signaled that they do not support resuming pandemic-related restrictions if cases rise. At-home testing and masks offer New Yorkers reliable and convenient ways to confidently and safely protect themselves and others, while allowing them to enjoy our city, Adams said in a press release. Officials said New Yorkers have received 20 million free at-home tests so far through city government initiatives. I encourage all New Yorkers to take a free at-home test as soon as possible to stay prepared, dress up in indoor public spaces, and take advantage of the life-saving treatments that are now readily available to us to help fight this virus, added the mayor. These combined tools are not only a boon that we didn't have access to before, but will also allow us to fight this disease in the future instead of in the past. The city's top doctor urged all New Yorkers, regardless of vaccination or medical condition, to wear face coverings indoors. Regular testing at home and wearing masks indoors, especially when cases are increasing, is the best way to protect yourself, those around you and your community, said Health Commissioner Dr. Ashwin Vasan in the press release. I advise all New Yorkers to dress up indoors, even if you test negative and especially if you are unvaccinated, have not received your booster, or are in a high-risk category.